This was just a great day, surpassed my expectations of what this workshop would be. And a couple of things that I really take away, thinking about, one of our things was to call out tensions and promise throughout the day on that path upstream. One tension that I hadn't thought about before until Dr. Gottlieb called it out was this aspect of healthcare, either investing in all the infrastructure it would take for screening for social determinants of health versus doing this geospatial mapping and determining its actions based on that, depending on where its patients were coming from. So I just thought that was an interesting thing to think about, since there are a lot of pros and cons around that screening part versus, I already know of one healthcare system that's doing it by zip codes, looking at where the patients are coming from zip codes and determining what to do based on what they know about those zip codes. So that was one interesting attention. Another one, and Darlene called it out for kind of the next tension going further, is that sustainability. Is this interest in going upstream and social determinants of health like the current bright and shiny object piece? And if we believe it's really important, how do we make certain that it stays on the radar screen and stays in our infrastructure moving forward, so it's still here? We're still talking about it 5 years from now, about how healthcare organizations go upstream and change the conditions in which their patients and communities actually have. Then the other tension, and one of the things that you should know, is that we can't put anything into the report that isn't said here today or presented here today. So if there's something that you believe is really important to this conversation that wasn't said, please come up and say it so we can put it in the report. So one that I wanted to get said was something that was said by Niall Brennan, who was a previous CMS Chief Data Officer, I believe was his title, that I heard him say recently. He said it was laudable that healthcare wanted to address homelessness, that was laudable. But is it rational that healthcare that's in this country that's very high priced and doesn't have really good outcomes, not necessarily efficient, be tackling social determinants of health? Of course, I didn't say it quite as colorfully as Niall said it, but I think he's thinking about that whole thing of healthcare and kind of what they've done before, and are they a good organization to begin to take this on, versus what he was saying is that healthcare really needs to be tackling its high price, its high cost. And if we could actually get healthcare costs down in this country, we could free up resources as a society to actually invest in a lot of what you want to do upstream. I think it's a both and. I think we want healthcare to find its role, but I think we also want healthcare to be addressing rising healthcare costs that are robbing the other social determinants of health. Okay, Josh, you can yank me off.